everyone. I am making a short video just to help get us prepared for survey. My name is Laura Cartwright. I am the RN Quality and Education Coordinator at the Highlands campus. So every year, obviously, we have a survey where the Office of Inspector General comes in and assesses us, usually over a 3-day period. And then if we do very well, like both campuses did last year, we would be deficiency free. But if not, they write citations and we'd have to correct those. This year, because of COVID-19, every survey is abbreviated to cover very specific things. So that's what we're going to talk about, is just prepping for a COVID-19 survey. So the 3 investigative tools that surveyors use when they're in the buildings that they go in are observation, interview, and record review. So we're going to kind of break those down. So observation, what are surveyors looking for? So when they're in our building, one of the biggest things they're going to be looking for is hand hygiene. So we've talked about hand hygiene, we've done hand hygiene observations. Everyone should know that it's a 20-second minimum for when you wash your hands. You need to wash them for at least 20 seconds. When to wash your hands is listed right here. So before you touch a patient, before a procedure, after a procedure, or after exposure to body fluids, after touching a patient, or after touching a patient's surroundings. So, and sanitizing your hands when you enter the room and when you exit the room, that's a really good habit to get into. So you don't even have to think about it. You'll just naturally do it every time. So every time you walk into a room, you put your hand under the hand sanitizer, and every time you leave the room, make sure you do it as well. Gloves are not a substitute for hand hygiene. Every time you put gloves on, once you take them off, you have to sanitize your hands. When hands are visibly soiled, you need to wash them with soap and water. So if you have something visibly on your hands, you can't just hand sanitize. And you have to make sure that hand sanitizer is dry in order for it to be effective. So down in that right-hand corner, you can kind of see it says, when using alcohol-based hand sanitizer, you put the product on your hands and rub it together, cover all surfaces, and it should take about 20 seconds. So covering all surfaces is a big deal too, because I think we all kind of just rub our hands together and think that that's covering it, but if you're not getting all the areas of your hand, then it's not going to be thorough. Something else surveyors are definitely going to be looking for is mask wearing and wearing your mask appropriately. This is a very easy citation for a surveyor to write. And we have seen some bad habits occurring. We all know masks are no fun to wear. No one enjoys wearing them, and I understand why we do some of these things these people in the picture are doing. But those are not appropriate ways to wear a mask. So when you are in a resident care area, anywhere where residents are, you must have on a surgical mask. You cannot wear a fabric mask. So you can see here in this image, the first lady, she has her nose exposed. That defeats the purpose. That's not serving anything. I see that one a lot. When I'm like out at the grocery store. There's a lot of people who do that one. The next guy, don't leave your chin uncovered. It needs to be creating a perfect seal. The whole idea is that we don't want air to get in and we don't want air to get out. So if it's not creating a seal, it's not doing that. This next lady, she has gaps on the side of her mask. That's not okay either. This fourth one, her nose isn't completely exposed, but part of her nose is uncovered. That's not really great either. You really need it to cover the full part of your nose. And if you have a mask that doesn't fit appropriately, get with someone here and we'll see if we can't find one that fits a little bit better. This one I see all the time. People just pull it down right under their chin. That's obviously not doing anything. So the very last lady there, she's wearing hers appropriately. Something else I've seen, don't pull your mask down to talk to someone. That defeats the whole purpose of wearing the mask. And I know why we do it. You know, it's a communication barrier. Especially for older people who may have difficulty hearing us in the first place, now they can't even see our mouths. It is difficult, but pulling your mask down to speak to someone, you might as well not have it on at all. If you do have your mask down for the reasons like eating, drinking, or smoking, you have to be 6 feet away from other people. Otherwise, you're running the risk of exposing them or them exposing you. Smoking especially, make sure that if you go out with a buddy to smoke, stand far apart from that person. You're taking something, inhaling it in, and then blowing out of your mouth and nose. So there's a huge risk there. So the other thing surveyors are looking for is proper donning and doffing, so putting on and taking off PPE appropriately. So this is just for COVID. So there's all different kinds of transmission-based precautions, but this is specific to COVID. So if someone is on our observation units, or they're a person under investigation, or they are positive for COVID, these are the steps we have to follow when we put them on, and then the next slide will be taking them off. So for the first one, of course, we wash our hands. We just talked about that. Second thing, mask. So down here on the left, you'll see a surgical mask. So asymptomatic residents who are in observation, and every resident in the building, we're wearing a surgical mask for. The N95 is for our COVID positive residents or people under investigation. And you want to do a fit check to ensure airtight seal. So see what she's doing with her hands there. She's taking her hands and pushing it down against her face and blowing air out to make sure that air is not coming out of any of the seal part of the mask. So we did our mask. The next thing you do is a gown. We want to make sure we're wearing that appropriately. It needs to cover your front and tie in the back. You want to wear it like you're putting on a jacket backwards. I see a lot of people wearing it like a robe, and they're just lounging around. That's not how it's supposed to be worn. It's not covering your front. The whole point is that it's covering the front of your body, your clothes, in case someone were to cough on you or sneeze on you, or you were to lean against something that had a potential trace of this on it, you wouldn't be getting it on your clothes. The next thing is a shield, but goggles are also acceptable according to the CDC. These must be worn for all patients that are COVID positive, under investigation, or those in observation. It's not an optional item. So if the shield is bothering you, or you can't get it to stay on right, or it's not fitting, goggles are an option as well, but you have to wear one or the other. And then the last thing is gloves. They go on last. And you want to make sure that there's no space between the glove and your gown, so you don't want any skin exposure there. So you can put the glove, if you have the cuffed kind of gown like this guy's got, you can put the glove right over the gown. If not, you can pull the gown back over. Just make sure you're not contaminating anything. So to take it off, or doff, there are 2 ways you can do it. So the first one that's approved by the CDC is what she is doing here, and taking her gown and gloves off at the same time. This is better for a disposable gown, one that we're not re-washing and using. You take your dirty gloves, because your gloves are the dirtiest thing. You touch them against your dirty gown, and then you want to pull it away from you to break the strings. And then you roll it down, only touching the inside, and you take your gloves off inside of it, ball it up, and throw it away. You never touch the outside of the gown or your dirty gloves. So that is one you may want to practice if you're not comfortable with it. Now, if you are wearing a reusable gown, I would suggest taking the gloves off first, and then you reach around to the back where your neck is and untie it, and you take your hand down to the clean part of your reusable gown, so go inside the gown and push it away from you, touching the inside, which is clean, and then you're going to pull it off of your arms. The next thing you do is take the shield off. You want to touch the back of the headband, not the front. The front is the part that could have been exposed, so don't grab with your bare hand the clear mask part, the shield part, and lift it off like you're a welder. That's not how it works. You need to only touch the headband part. And we want to wipe that shield down with at least 70% alcohol, or you can use soap and water. So down here, the cleaners, we have the blue top, which is Sani Hands. It's at least 70% alcohol. The purple one, which is a Sani Wipe. And then you have this Easy Screen, which is really for like electronics. Any one of those, whatever you can get your hands on, is fine. I do not recommend using the bleach for starters. It's way stronger than you need it to be to kill what we need it to kill, and it also leaves this horrible haze on anything that's clear like that. So it would look dirty and it'd be hard to see out of, so don't use the bleach. So you take your gloves, gown, shield, and then we're going to wash our hands. The big thing here is when you're taking off, think about what is dirty. So your hands are the dirtiest thing because you went in there to do something, you grabbed things, you touched things that have a potential exposure. The second thing is your gown and then your shield. So that is the way you take it off. And then you wash your hands. So if you accidentally touch something that was potentially contaminated while taking your PPE off, don't freak out, just stop and perform hand hygiene. So if you are taking off your gown and you accidentally touch the front of your gown with your bare hand, it's not the end of the world. Go get some hand sanitizer, rub it in, and continue what you were doing. Something else that surveyors are looking for is cleaning of medical equipment, specifically shared equipment. So we run the risk of spreading COVID-19 by not ensuring that shared equipment items we use on multiple residents is disinfected appropriately. So this little chart over here on the right has some of our cleaning products and the things that we commonly use for multiple people. This chart is available. I can send it out to whoever needs it. It's hanging up on some of the units. I'm in the process of making additions to your badges that will have this and how to don and doff PPE for COVID-19, and we'll be giving those out on Tuesday at the testing. This is another good habit to get into. So every time you use a blood pressure cuff, wipe it down. Every time you use a thermometer, wipe it down. Every time you use a lift, make sure you wipe it down. And once you get in that habit, it'll just be second nature. Anytime medical equipment touches a resident, it's got to be wiped down. It's considered contaminated, so keep that in mind. So over on this little chart, you can kind of see blue is safe. It's just alcohol. It's the same as like a handy wipe you would get at a restaurant. It's the exact same thing. It kills germs. The purple top is a bloodborne pathogen killer. So it can kill different bloodborne pathogens. So it is a little bit stronger. So for your glucometers, your PTI NR machines, and your med carts, just because that's where those are housed, you want to wipe things down with the purple top or violet top. And then the orange is bleach. So it is the strongest cleaner that we have in this form, in the wipe form. It's really used for C. diff and norovirus, something that only bleach can kill. It's really more than you would ever need for to kill COVID-19, and it's got a longer dry time. So the blue top one, just to go back, just is the amount of time it takes to dry. It's about 20 seconds, just like hand sanitizer, and it should work appropriately. The purple top is a 2-minute dry time, so it has to sit on like a PTI NR machine or a glucometer for 2 minutes in order for it to be most effective. And then you can store it or use it on someone else. And then the bleach ones are 3 minutes. So if you were to wipe something down with those bleach wipes, you have to wait 3 minutes or it's not going to be at its highest workability. Something else that they're going to be looking for, environmental cleaning and disinfection. So surveyors may monitor our EVS staff on their cleaning process. They're going to be looking for thorough cleaning of high-touch areas, as well as cleaning practices in common areas and resident rooms. So they may ask you questions related to which solutions are used and if they're approved to kill COVID-19. So if you are ever asked that question, we use a Hilliard product, which is called QT3, and it is EPA approved. It must sit for 3 minutes. So just like our bleach, it's got to sit for 3 minutes in order to be most effective. It must be sprayed on surfaces. So we can't soak towels in QT3 and then wipe stuff down. It won't have the same effectiveness because we can't ensure that it's set for a full 3 minutes. And QT3 can be used on all surfaces, which makes it super nice. So we can spray recliners down, electronics, curtains, any fabric, any electronic, anything like that. QT3, just the 3 minutes. So QT3, 3 minutes, that's how you remember that. So interview. So that's what they're looking for on observation. Of course, they could be looking for other things as well, but those are the big things that they're told to look for. Interviewing is a little bit different. Mainly what they want to know about are our policies and procedures. So something they may ask you about is screening of staff. You know how we screen staff. We do it every single time you work. You come, you have your temperature taken, assuming it's fine. You go fill out the line list, and then you proceed on to the day. If there was ever any question about anything that you answered, or if your temperature was out of whack or too high, we would ask some follow-up questions. Screening of residents. So our residents are screened every shift on this campus 3 times a day for every symptom of COVID-19. And those are audited daily, and nurses have access to a decision tree on all of their medication carts that can help them decide what to do if their resident begins showing symptoms. So that's what this little thing at the bottom here is. That's that COVID-19 decision tree. If you don't have a decision tree on your medication cart, let me know and I can reprint you one. But if your person starts having a cough and diarrhea and a sore throat, all you have to do is go right to this chart and say, does this person have a fever? No. Do they have a cough? Yes. Do they have any of these other symptoms? Yes. And it'll tell you right there what to do. Put them in droplet isolation. Swab them for COVID-19. So it's a very easy thing to follow. So you don't have to really question what to do next. Something else you may get asked about is testing. Surveyors may want to know what our testing requirements are. So we test based on the prevalence in the county. So if you see the little state of Kentucky down here in the bottom right, this is from this week. So each county's color is the indicator of how many or how often that county has to test. So the green and yellow ones are like we were a few weeks ago. It's just every other week they would have to test. Orange counties, which is what we are now, is weekly, and then red counties are twice a week. So I hope we never have to do that, but these unfortunate counties that are in the red do have to do that. But that is what we go by. So at this moment we are testing weekly, but that could change. If COVID cases go up, we could test twice a week. If COVID cases go down, we could go back to every other week or even once a month. At this time, we administer the nasal swab and the tests are sent to Gravity Labs and we receive results within 48 hours. We notify staff if they test positive as soon as possible, and then they would also be contacted by the Department of Health. Other policies and procedures. So notification of positive cases. Surveyors may ask you how staff, resident families, and residents are notified if we have a positive case. So for staff, we send out on-shift messages. We would inform everyone that way if there was a positive case. And then nurse management would review the schedule to see who had potential exposure to that person who tested positive, and we contact them separately and we'll decide if they need to be tested or not. It's important to have on-shift on your phone or computer so that you can get this information. If you need assistance with on-shift, please get with education, scheduling, or human resources. Resident families. All resident contacts are pulled from their face sheet and entered into a database we have called One Call Now. Administration will write an explanation of the exposure, and that message is sent out via phone call, email, and text messages. And then families can also get information on facility cases by going to nashome.org/COVID-19. Residents who had potential exposure will be placed in observation and tested. We notify them when we test them and inform them that they will remain on transmission-based precautions for 14 days if they're asymptomatic. If they're asymptomatic for the 14 days, they tested negative, they can come out. All other residents will receive a letter with the same information that's given to the resident family. So that same resident family note that we send out on One Call Now, we print out and hand out to our residents who did not have a potential exposure. Other policies and procedures they may ask about is supplies. So surveyors may ask you about our PPE supplies and its availability. So alcohol-based hand sanitizer was at one time difficult to acquire, but we currently have an ample amount. If a hand sanitizer Purell machine is not working, you contact Environmental Services and they will restock it. As far as gowns, on our observation unit and during COVID testing, we are utilizing reusable gowns. These hang on hooks in each room during your shift, and when you're done using it for the day, the gown is thrown into a soiled gown bin. If you're not having direct contact with the person in the isolation room, so let's say you're going around and you're just picking up dirty trays, You may use the same gown for all the rooms and then remove the gown and toss it in the soiled laundry bin. But just make sure we're not touching anything or any person with that gown on. If you have any contact with a person, you have to take that gown off and throw it in the bin and put a new one on before you go in another person's room. Shields and goggles. We are reusing shields and goggles. They are required to be wiped down after each use and placed on hooks or in the transition space, just depending on the layout of that space. Masks. Surgical masks are available at the front temperature station. We want you to replace your mask if it becomes wet or soiled. And then N95s can be acquired if it's required. So if you needed one, you would just have to ask and we could get you one. Gloves. We have not had any issues with gloves. We have plenty of gloves. If you need any PPE, it is in the supply room down here in the basement. Use your badge to enter and make sure that you write down everything that you take and what resident and room you took it for. So if you needed gloves or someone started showing symptoms and we followed that chart and it said to put them in droplet isolation, you would come down here, you would get in the supply room, you'd grab a cart, make sure it has everything on it that you need. You'd get some reusable gowns and you would write all of that down and write the name of the person and what room you took it to. Other policies and procedures, dedicated equipment. We just talked about shared equipment that's not properly disinfected and how that could lead to a spread of COVID or other germs. Patients and residents in observation and patients under investigation. We have a bag of dedicated equipment that's provided to residents on transmission-based precautions. So we are going to use that dedicated equipment for those people. Once that person is DC'd from isolation and dedicated equipment is cleaned and then disinfected and placed in a new clean bag in the room for the next person admitted to that room. These bags have thermometers, blood pressure cuffs, stethoscopes, and an O2 set. So if you're a nurse and you're on the cart and you have an O2 set on your cart, we will not use that one in a room that's on transmission-based precautions. All of this should be in the room ready to go for you. And when that person comes out of isolation or they're through with their monitoring period or their observation period, all of that would get disinfected, placed in a nice new clean bag, and then when that room empties out, they'll terminally clean that room and that bag will, the new clean bag will go back into it. Resident precautions. Surveyors may ask you about precautions in place for the residents. All residents who are out of their room must have a mask on. That's something we've educated all of them on, especially the ones who would like to be out more. Masks have been provided to all the residents and more can be given if needed. So if they lose them or they don't fit appropriately, we can get them another one. Residents who attend mass, dining, and activities will be required to social distance during these activities and must wear a mask. During dining, their mask can be down, obviously, because they will need assistance with meals, but they need to be at a minimum 6 feet away from the other person who's eating. Visitor entry. Vendors and approved outside services who enter the building, so some physicians like the podiatrist, repairman, funeral home, they must fill out a screening form at the front and they have to have their temperature taken, just like we all have to do every day. And then they must be escorted the entire time they're in the building. So they don't get free range to just kind of float around and go wherever they want to. Someone needs to be with them at all times. Families who have been approved to have a compassionate visit have to be screened, hand hygiene has to be performed, and they must wear PPE. All of that's available at the front entrance. And this would obviously have already been approved. This is something set up with the director of nursing. They must be escorted to the resident's room and they are not permitted to go to any other portion of the building. When their visit's over, they must be escorted back to the front entrance. In-person visits. In-person visits are pre-scheduled and at this time they take place in the chapel. That may change. But for right now we're starting back up in-person visits and they will be in the chapel. The visitor must fill out a screening form. A test to follow all rules and visits are limited to 30 minutes and no more than 2 visitors are permitted. We'll do cleaning prior to and after the visits on all the surfaces. And if the visitor develops symptoms after they visit, they attest to report that to us and to the Department of Health. So a question that comes up every survey time is, what if you're asked something and you don't know the answer, or you're not sure of the answer, you're afraid to answer because you're not sure if it's right? You just need to say, we've had several changes over the past few months to keep up with current guidance. let me make sure I'm telling you the correct information. That is a perfectly logical thing to say, because they could ask you about visitation. That has changed several times, and it could change again if we had a positive case or if something were to happen. So that is a perfectly fine statement to make. So the last thing is record review. So if you read over the surveyor protocol, they will not have more than 2 surveyors in the building when they're surveying. And they typically only stay for 2 days instead of 3. There will be other surveyors performing record reviews off-site. So they'll be like in whatever office space they're working out of, and they'll be reviewing records at that time. Some things they may ask for, they're going to want access to our medical records, just all of Matrix, COVID-19 care plans, policies and procedures, infection control tracking, employee screening records, visitor screening records, communications we've given to the families, and communication to health officials. So possible outcome of non-compliance. I'm going to go over this. I'm not saying this to frighten anyone. I just want everyone to know that there are actions that happen if we are out of compliance, and they are stricter than normal. So non-compliance for an infection control deficiency when none have been cited in the last year. So that would be both of our facilities. We were both deficiency free last year. So if we were to get an infection control deficiency at the level D or E, we would have to do a plan of correction. That's very typical. If it's widespread, so if it was higher than an E level and they found that it was a problem throughout the building, we would have to do a plan of correction. We'd be denied payment for new admissions, and we'd have 45 days to demonstrate compliance with our infection control deficiencies. If it became a harm level, so if they witnessed something that could have the potential to cause harm or has caused harm, we'd have to write a plan of correction. We'd be denied that payment. We'd have 30 days to demonstrate compliance. And the harshest one is an immediate jeopardy, regardless of your past history. So there are mandatory remedies. You would be given 2 options if you had an immediate jeopardy. You could either have a temporary manager come on site and take over management of the team, or you can terminate from your Medicare Medicaid program, and all of the residents would be moved out to another facility. Obviously, that would be the most dramatic, difficult immediate jeopardy situation. There would be a plan of correction. You'd be denied payment for new admissions. You would only have 15 days to demonstrate compliance, and then you would have a fine. And you're fined for every day that they find that you are out of compliance. So if 2 months ago we did something and it led to harm or it led to an immediate jeopardy situation, they could potentially fine us for every single day that we were causing an immediate jeopardy. This is just something I want to show you. This was an article. CMS has fined, this was in May, $15 million in fined nursing homes for COVID-19. So that's 3,400 nursing homes that have been fined during the pandemic for non-compliance with infection control requirements and failure to report data. So over here on the right, I just have some common violations, things that they have found. Equipment not properly cleaned and disinfected. Staff failing to wear masks and washing hands. Dirty laundry and linens were not stored or handled properly. They had nurse aides who had not received training in infection control in more than a year. Some other things were there was an unmasked receptionist eating a meal that was not 6 feet away from other staffers. A patient restroom didn't have paper towels. They just had a cloth towel. Dirty gloves, soiled towels in the sink and on the floors, spilled things on the floors, just a dirty environment. Medication cart did not have the proper supplies to clean a glucometer, and the person who was using it didn't wash their hands or change their gloves. So the key takeaway, if you have any questions about any policy that we have or a process we're doing or changes that have been implemented, don't hesitate to reach out to management of any department, environmental services, dietary nursing, or our administration team. We want everyone to be informed and up to date on what is going on. You can also always email covid@nashome.org with any questions, and someone will get back to you quickly. Last of all, I just want to say thank you. This year's had so many challenges and changes, but I want you to know that what you do is important and that it takes a strong person to do it. You are so appreciated for the work that you do every day, and we are very grateful that you are here. Well, thank you. Have a great day.